I'm Dr. Shilpa Gupta. I'm a genitourinary medical oncologist at the Cleveland Clinic in Cleveland, Ohio. My main area of clinical practice and interest is bladder cancer. Today, we'll talk about what is the role of immunotherapy in cisplatin-ineligible bladder cancer and whether it can be used first line. As we know, immunotherapy has really revolutionized the way we treat bladder cancer. And prior to its approval in 2016, after patients got platinum-based chemotherapy, we really had no treatment options for over 4 decades. And immunotherapy was first approved in patients who had prior chemotherapy and then slowly inched its way in frontline setting for cisplatin-ineligible patients, that is patients who are not robust enough to get cisplatin due to either renal failure or grade 2 or higher hearing loss or heart failure or grade 2 or higher peripheral neuropathy or just poor performance status in general. And since then, the field has evolved, and now we are learning that immunotherapy may not be the best thing to do in the frontline setting anymore for those patients. And I'll review some data and key points about that. So first, we'll go over how frontline therapy has evolved in cisplatin-ineligible metastatic urothelial cancer patients. Prior to 2017, gemcitabine and carboplatin is what we had for these patients, and the overall survival was pretty dismal at about 9 months. And when immunotherapy first received FDA accelerated approval in 2017, based on 2 single-arm trials, atezolizumab was studied in IMIGRA 210. Cohort 1 showed that response rates were around 23%. Median overall survival was around 15.9 months. And these were really durable responses. And then the Keynote 052 trial showed that duration of response was really significant, and patients did so well compared to chemotherapy historically that it led to a lot of excitement in the field, and these 2 agents were used widely for patients who were not cisplatin eligible. However, in June 2018, based on the confirmatory trials, which were phase 3 trials comparing immunotherapy with gemcitabine and carboplatin in cisplatin-ineligible subgroups, it was found that patients who got immunotherapy from both these confirmatory trials for both atezolizumab as well as pembrolizumab, those patients actually did worse. And there were early deaths in patients receiving immunotherapy compared to gem-carbo. And at that time, FDA restricted the use of these agents to only those patients whose tumors express PD-L1 at the threshold for these drugs, or those who were not even fit enough to receive carboplatin. Notably, they did not define what is that category, but that was the label restriction. And here we are now that based on Javelin Bladder 100 trial, gemcitabine carboplatin followed by avelumab maintenance is the preferred approach for patients who are ineligible to receive cisplatin. And further, pembrolizumab label was restricted to only platinum ineligible patients after the FDA meeting in August 2021.